Peds infectious rashes is going to be about the viruses that cause rashes, viral exanthems. And what you're going to need to do for the test, and a little bit in life, is be able to identify what disease it is just by looking at the kid. None of these have a diagnostic step. What you're going to use is the timing of the rash relative to fever and the prodrome to help you make the diagnosis. None of these have a diagnosis. None of them have a treatment beyond supportive. So what you need to know is, one, how do you prevent them? And two, if you didn't prevent them and baby gets infected, what could happen later on in life? We're going to go through each disease one at a time. We're going to start with erythema infectiosum. Erythema infectiosum is the slapped cheek disease, or Fifth's disease. It is caused by parvovirus B19. And what you're going to see is slapped cheek disease. So called because it looks like baby has taken two really big slaps against the face. Their cheeks are going to be big, red, and rosy, and that is where the rash is going to be. This slapped cheek appearance will occur fever and a rash. They occur at the same time. Now we're going to use this cartoon diagram to identify the location and spread of rashes. Parvovirus B19 is going to be on the cheeks. Now that's not necessarily truthful. Can it be on the arms and shoulders? Sure, but what you're going to see is a picture of a baby with really red cheeks, and it's a virus question. The answer is parvovirus B19. The diagnosis, as we said, is going to be clinical, and the treatment, as we said in the beginning, is going to be supportive. But what do you need to know about erythema infectiosum? Doesn't sound like it does very much. Indeed it does. If you have a hemoglobinopathy, it may provoke an aplastic crisis. This is especially true in kids who have sickle cell disease. Also other hemoglobinopathies, but sickle cell plus parvovirus equals aplastic crisis. And also hydrops fatalis. Hydrops means dead baby, which means that baby should be isolated from mom. That is to say, if mom is pregnant with another kid and her current kid has parvovirus and gives it to her and gives it to the baby in utero, hydrops. So if baby has parvovirus B19, separate from mom if she is or trying to get pregnant. If baby has hemoglobinopathy, watch out for aplastic crisis. This one's pretty much unique. Let's compare the two different measles together because people get them confused a lot. That is going to be measles and German measles called rubella. Let's talk about measles first. Measles is going to be caused by parvomyxovirus. And the patient is going to present with the prodrome. Talk about the prodrome in a minute. Then what you're going to see is fever and a rash. The fever and the rash occur simultaneously, and what you're going to see is the rash begin on the face, and then it will spread down the trunk and arms. It will also clear the same way. The rash starts on the face, works its way down. Fever and a rash at the same time is a little misleading because usually the fever begins as the rash begins to spread. But what I want you to learn, put in your brain, measles, fever, and a rash. The prodrome for measles is going to be the hard C's. There are 4 of them. That is cough, coryza, conjunctivitis, and Koplik spots. Now technically Koplik spots is with a K, but makes the advanced organizer work having 4 C's. So what you're going to have is a kid who gets infected, right? It looks like he's got a virus. Cough, runny nose, bloodshot eyes that are a little runny, and oh, what's that in his mouth? Little white dots in the mouth. If they show you a picture of a mouth and there are little white dots all over the place, measles. The diagnosis is going to be clinical and the treatment supportive. But this is one of those diseases that baby really shouldn't get because we have a vaccine, the measles, mumps, rubella, varicella vaccine. Check out our vaccinations lecture for more details on who should get and who should not get MMRV. But basically, nobody should get measles because we have a vaccine against it. So to give you a patient with measles, not only must they show you the rash and the Koplik spots, they have to give you a reason why they didn't get vaccinated. Allergy, anti-vaxxer mom, or immigrant from another country that doesn't have health care. Something that tells you they did not get routine care. And this one is important to pay attention to in regards to the vaccine because if baby gets the measles later on in life, they can develop subacute sclerosing panencephalitis. So if you see something about a virus question and later on in life having brain problems, think subacute sclerosing panencephalitis. And if you see the words subacute sclerosing panencephalitis, they were exposed to measles. Now rubella is called rubella, but it's also called German measles. Why is that? Well, that's because the way the disease progresses is literally identical. That is, there's going to be a rash on the face that then spreads to the trunk and arms. Just like measles. There will be fever and a rash. But rubella is caused by rubella. And it's the prodrome that is going to separate rubella from measles. Rubella's prodrome is going to be generalized and tender lymphadenopathy. If you see a baby with a rash on the face, fever starts, spreads to the trunk, the thing you should do is look for swollen tender lymph nodes, rubella, or look in the mouth for the Koplik spots, measles. They're both clinical diagnoses and there's both nothing to do about them except support baby through it. And they both come in the exact same vaccine, measles, mumps, rubella, varicella vaccine. There is no associated sequela with rubella. There is for mom if she gets infected, but we're not going to talk about that here. That's in the OB lectures. I just want to compare again. Everything is the same except for the prodrome between measles and rubella. And no one should get either vaccinate. Roseola I do next because you see why it makes a big difference about talking where does the rash start and where does it go. Roseola is caused by HHV6. And the prodrome here is going to be a very high spiking fever. Generally, the baby is going to get to above 104 degrees, and they'll get there fast. And the rash is going to occur after the fever breaks. The fever breaks before the rash. So it is fever, then rash. This is the first time we've seen it so far that it's fever, then rash, as opposed to fever and rash. And roseola's pattern is exactly the opposite of measles and rubella. That is, the rash starts on the trunk and expands outward. As always, the diagnosis is clinical. The treatment supportive. But because there's a high spiking fever that it goes high and gets there quickly, you have to be aware of febrile seizures. Now, we talk more about febrile seizures in the seizure lecture, separating complicated from uncomplicated, just know that febrile seizures need to be aborted with benzos if they last more than 5 minutes. And you can control the fevers, which don't necessarily reduce the frequency of recurrence of febrile seizures. But if you're going to control the temperature, use acetaminophen, not aspirin. Aspirin causes Rye syndrome. Acetaminophen is the only thing you should use if a baby has a really high fever. All right, the next disease I'm going to talk about is actually two diseases in one. One virus, two problems. That is varicella zoster. Varicella zoster is the disease, the bug that causes it. And varicella in an adult will cause shingles. In baby, it will cause chickenpox. Let's talk about chickenpox first, and then use it to talk about the sequela, shingles. First off, there is a rash, usually without fever. It's the first departure from these other diseases. And the rash is going to be that of varicella, which is described the same way as herpes. That is to say, you're going to have a diffuse rash. That will be, and these are the key words you're looking for, vesicles on an erythematous base, and in different stages of healing. Eruption is where the skin gets red and a little whitehead comes out. Ulceration is where the top is cleaved off and it looks like an ulcer. And then crusting is how this finally closes over. There are going to be all of these vesicles all over the place in different stages of healing. That's how you make the diagnosis of chickenpox, which is, of course, a clinical diagnosis. And for a kid, chickenpox is supportive. Now, I brought up the herpes business because if you look at the STI lecture in medicine, you're going to see that you used to be able to do a Zank prep, looking for perinuclear halos for herpes. Don't do that for varicella. And now you know, okay, well, the better one is PCR. I got to make that diagnosis. Don't do that. For chickenpox, for varicella zoster, the answer is clinical diagnosis. You make the diagnosis by looking at it. And you're going to treat supportively. Now, what we used to do was pox parties. That is never the right answer. The idea is that if you get chickenpox as a child, it is usually less severe than as an adult. And getting chickenpox means you are therefore immune to the virus in the future. So before we had a vaccine, we would have kids infect each other. One kid in a network would get chickenpox, and all the mothers would bring the kids over to co-infect each other. And then you were done. But even that can lead to disfiguring scars and also shingles. So now what you're going to do instead is the measles, mumps, rubella, varicella vaccine. If you vaccinate against varicella, they never get chickenpox to begin with, and they never have to worry about shingles. So what this looks like in baby is going to be all of these little vesicles in different stages of healing all over the body. They itch, they hurt, baby cries a lot, but it'll eventually go away on its own. It doesn't just go away. Varicella hides in the dorsal root ganglion. That is a sensory cell, and it hangs out until someone gets immunocompromised, where it reactivates. So now in an adult, and you'll notice the difference in the shape of the adult from the kid, what you'll see is in the dermatomal distribution of that dorsal root ganglion that never crosses midline, you are going to see the rash develop. The only way this happens is that you get immunocompromised. And the most common way of that happening is you get old, over 60. You get immunocompromised, you get reactivation. And reactivation begins with a painful prodrome. If you've ever seen someone with shingles, you know that if you just wave your hand at their skin, it's going to hurt like crazy. It's going to burn. And it may be present, that pain, even before there's a rash. Then you're going to get the same vesicular rash, only it is going to be inside a dermatome. And it never crosses midline. This is important as you do the test, because if they show you a picture of a rash that abruptly stops at midline, front or back, and there are vesicles, it's shingles. Again, the diagnosis is clinical. And you can't really do that much about it. You might be able to give some acyclovir to reduce the duration. And post-herpetic neuralgia, because this thing hibernates in the sensory nerve, can cause pain. Pain that lasts after the rash is gone. That pain should be controlled with tricyclic antidepressants, gabapentin, or pregabalin. Notice I'm not writing that on the board. What you should have done is give the shingles vaccine. For those people who have had chickenpox and are over the age of 60, they need the shingles vaccine, which will reduce the chances of them getting shingles. But it all comes back to the vaccine as a child now that we have. If you just vaccinate, no one will have to worry about this thing at all later on in life. We're going to close with two that are very specific and the lowest yield. That is going to be mumps and hand, foot, mouth disease. They're not low yield in the way of not important, they're low yield in the way of they're really easy to spot and you shouldn't miss them. Mumps is caused by the mumps virus. And while it can occur in any age, where you're going to see it is in pubertal males presenting with parotid swelling and orchitis. Parotid swelling and orchitis. I bring this up because in our pictographic representation, it might look like slap cheek, but you're not going to mistake the two. Slap cheek's an infant and has red cheeks. Mumps has these big swelling things on the side of their face, and testicles are also swollen and painful. The diagnosis is clinical, the treatment supportive, and what you should have done is given the measles, mumps, rubella vaccine. And the thing about this is why it's going to be in males is if they have orchitis, it may lead to infertility. But again, if someone's going to give you a question about mumps, it has to be someone who has not been vaccinated, and there has to be a good reason why in a vignette. They have to tell you that they haven't been vaccinated without saying the words, haven't been vaccinated. Lastly is hand, foot, mouth disease. This is caused by Coxsackie. And what you're going to get is varicella. It looks exactly like varicella, except it only occurs on the hands, feet, and mouth. So if you have vesicles all over the place, but they're isolated to the hands, face, and feet, hand, foot, mouth disease. Now, it could be on the buttocks, but if you see that distribution where the whole trunk and most of the extremities are spared, it's hand, foot, mouth disease. So what this is going to look like these vesicles on the hands, feet, and face, or mouth. The diagnosis is clinical, the treatment supportive, and there is no vaccine for hand, foot, mouth disease. Step back, go through the highlights of each one. Erythema infectiosum, slap cheek syndrome. Look for the red rosy cheeks in a picture of the baby. Watch out for hydropsittalis, isolate mom, and aplastic crisis, sickle cell disease. Measles and rubella are going to be a rash that starts on the face and goes down the chest and arms. Fever and a rash. Separate measles by having cough, coryza, conjunctivitis, but really, look in the mouth, white stuff, little dots, complex spots, that's measles. Tender lymph nodes, that's rubella. Both of them are clinical, both of them are supportive, both of them come in the same vaccine. Measles causes the brain thing. Roseola is caused by HHV6. Really high fevers, the break, then a rash occurs on the chest and spreads out all over. Nothing you can do about it. Just supportive, but watch out for febrile seizures. Varicella zoster, 2 diseases, chickenpox and shingles. If you vaccinate against chickenpox, shingles becomes a non-entity. If you have had chickenpox in your life, you can get shingles. Vaccinate against varicella or vaccinate against shingles. What you're looking for is vesicles on an erythematous base in different stages of healing. In kids, chickenpox is all over. In adults, it is contained to the dermatome. Mumps, parotid, and testicles should have vaccinated. Hand, foot, mouth disease is varicella zoster looking except only on the hands, feet, and mouth. That is Peds infectious rashes.